I think I said before, we start really seeing moving the needle when you're starting getting like 8+ agents, and again, the other thing is that, everybody's different. So you see what happens. So you hit them with a regimen that, that kind of works well. And okay, then you look and see, is the cancer responding? And if it's not, then you make adjustments. That's the thing. We don't just keep saying, okay, we're just going to keep pounding at the same thing. If I see that what we're doing is not working, then I'm going to step it up. I'm going to change. I'm going to look and see what else can I do? What can I add to this regimen to make it work? It's just a matter of being, persistent and keep just going after it. And if you keep attacking the cancer, keep hitting with stuff, eventually it seems like the immune system's going to see it, right? So,
and that is the interesting thing, and that's a question that often comes up is patients ask, well, how many treatments do I need?
Yeah.
Some patients we've seen 3 treatments will eradicate stage 4 disease, right? They go into remission, and they've been there for years.
I just have a few cases now, and just did one recently, hepatocellular carcinoma. We've been knocking those out almost in one shot. That's like amazing response, but other cancers take, 3, 6, 9, 12. You don't know. It depends on what that person needs in their cancer. So it's a lot of times it's hard to assess. Like the person wants to know, you say, well, look at how much cancer they have, what type of cancer, you can make a guess what it might be, but you don't really know till you get in there. They could be easy or they could be hard, but once you get 1 or 2 treatments in, you start getting a feel, okay, this is going to go easy, or this is going to be a lot harder. We're going to need to, and we're going to make adjustments and step it up.
Yeah. Cause there are studies ongoing where people are doing intratumoral immunotherapy with one drug.
Yeah.
And they're using the kind of classical systemic immunotherapies. And so hats off to them because they are stepping into that new arena. But as you've highlighted already, that's the same magic bullet theory that it just never cut it, never will cut it. And so you've basically blown past that and recognized already, as you've already said, look, no way can you do this with one. You have to bring a multitude of immunotherapeutics together.
For, like I say, for 10 years now, 10 years exactly, we've been using minimum 3, 4 agents. So 10 years ago, we would definitely use, Opdivo Yervoy or Keytruda Yervoy, and probably a couple other, assisting agents as well on top of that. But that's been for 10 years. So there would be no less than that. Yeah. And since then, obviously, we've evolved in using lots of other drugs.
And what I've seen as being a part of this team now for about 8 going on 9 months is that really, by targeting the tumor here with intratumoral immunotherapy, what you're doing is you're targeting the problem clearly, and it's creating the problem within the immune system. But what you're doing is you're also setting the stage for long duration therapy, meaning you're setting the stage for remission because you're empowering the immune system. Whereas if you look at chemo or radiation, they actually can shrink a tumor, just like intratumoral immunotherapy or their intratumoral ablation can. But the damage it does to the immune system does just the opposite. It actually counters that long-term duration effect. But here, it's a combination of target, immediate, and long-term effects.
Yeah.
And so it really turns the process of how we've approached cancer in the past, and it's changing it to, let's just take this on a chronic basis and just nick away at it, let it go away. Now, sometimes it's gone like that. Stage 4 pancreatic cancer gone in 3 months. Okay. But sometimes it does take time. Cancer is not going to wave the white flag and give up.
Yeah.
But the approach that you've innovated and brought forth allows you to pivot, adapt, and not just target the same tumor, right? You'll pivot to different areas of a tumor.
Yeah, we look
all together.
Exactly. You got to see what's going on. You can look and see there could be multiple tumors. Some could be responding, some are not responding. You look at the ones, okay, they're not responding. Maybe we should go after those directly. Maybe we need to try to get the immune system to see something in those that, is different. And, that's definitely the key. You just keep hitting it, keep being persistent, add, change, do whatever you need to do. Basically we just try to do whatever it is to get the patients to respond and get, to a complete response. I mean, that's our end goal. I mean, we don't really want to go short of that.
Yeah. And I've heard you say something before that I think it rings really true. It's not can we get you there? It's just how many therapies does it take to get you there?
Right.
Some it takes few, and and this is the hard part is there's no predictability to it. Now, from my standpoint, I would think maybe the more chemotherapy somebody's had, if they've had 2 years, 3 years of chemotherapy, the impact on the immune system there is going to make it a longer run. But sometimes I'm shocked by people that have been on chemotherapy and how quickly they respond.
Yeah, it depends. Obviously in the ideal situation, we get people before they've done anything. Unfortunately that's not usually the case, but yeah, you just have to keep pounding and doing it and figure it out. I mean, it's just like, I'd say it's like failure is not an option, right? You just have to find what works and keep doing it.
And this is something I've mentioned to you several times in the team is that one of the things that I've noticed is the quality of life. When you look at when people go into cancer treatment, there's an imagery in their mind. And that's why I think there's so much fear associated with it. And it's not that eventually they succumb to the disease. It's what the rest of their life looks like.
Yeah.
Basically, it's not that they lose their life when they pass. They lose their life when they're diagnosed and they undergo treatment.
Mm-hmm.
But what I've seen firsthand, and I've been doing this now 7+ years in the integrative oncology space, is this concept of trying to get through treatment where you achieve remission from a systemic to tumor approach, then recover so you can then live. That is, for lack of a better term, bug. My kids are going to hate to hear me say that. But what this is you're actually targeting the tumor, activating the immune system. So starting the local treatment and the systemic treatment at the same time and the long-term duration treatment and improving the quality of life from day one.
Yeah. So the thing that's interesting is that when you start seeing where you're getting the immune system to attack the cancer, you're actually starting to see that you're making the patients healthier because you're boosting that immune response, and it's not affecting just cancer, but it's also affecting other things too. And obviously we know that these things are resulting in killing up of, senescent cells and older cells. And so it technically makes the patient, younger in a sense, right? And that those, are improving the person's health. So it's like it's a cancer treatment that actually makes the person healthier. And that's the whole different than cancer treatment of the past.
So it's a regeneration approach to the immune system in part, and that then spreads to the rest of the body.
Yeah, exactly. Yeah.
Now, one of the things people think about intratumoral immunotherapy. They think, okay, it's just Keytruda, it's Opdivo, it's Yervoy, or take your immune checkpoint or systemic immunotherapy, and you're injecting that into the tumor. But we're not confined to that, right?
No, we have a lot more options of things. So, if you were just confined to the standard drugs, you'd be limited. But yeah, we go way beyond that, and so that's one big advantage that we have.
Yeah, is the ability to not just target, one aspect of immune dysfunction, but able to target, genomic mutations, able to target with oncolytic viruses. And I mean, just a whole multitude, even cytokines and inflammation, just really working to empower the immune system to turn on the tumor, because the tumor is going to turn the immune system against itself. Mm-hmm. And so here you're actually turning the immune system against the tumor, creating an environment where the cancer just can't coexist.
Yeah. Yeah.
So, I mean, I know it's taken you a while to evolve there, but it's clearly been something that's been in your consciousness for a while. So here's a quick question, because you've been doing this for a while. Have you noticed that the conventional community is becoming more interested, accepting, open? What would you describe there?
Yeah, I would say so. Yeah. I mean, I think now more and more, I mean, unfortunately you got like surprises me. And I mean, I've had meetings with like numerous oncologists, and some of these are top oncologists at centers. And, it surprises me when I talk to them, they're like, oh, they're the top. And I'm like, you guys do anything to address the gut microbiome? No. Yep. Have you ever even read my book? No. I mean, like, I'm thinking like, you're supposed to be like the top, but you're missing out on so much stuff. I mean, they're just the top of what's the basic standard, and that's, way behind things. And so, but they are becoming more accepting and understanding. And when I explained to them that, I think a lot of them, it blows their mind. I was meeting with one group of oncologists last week, and I think they were completely shocked. I think that they thought that they were on top of the world, and they had no idea that this stuff even existed. I mean, it just really, I don't know. They were speechless. I mean, they didn't even know what to say.
They didn't know it existed?
They had no clue of all the different possibilities of things, and that people were actually doing this type of stuff. And a lot of it was completely foreign to them. And they thought that they were the top of the game, right?
So you reached out and said, here's my hand. Come on up. We'll help you up to the next level, up to the top.
Yeah. I mean, again, we want more people having access to this. And so that's why I talked to them. Like, look, we want you guys doing this stuff. We're not trying to like say this is just us. I mean, we want others doing it. We want, the more and more people doing this, it's going to help more people. And that's the real goal.
And that's what I've seen about, you, Jason, and I knew that from a long time ago, but I didn't, during medical school, it was just study. So at least for me, there was not a big opportunity to, focus outside of that, but I knew there was something different about you. But, your approach to treatment, your approach to basically helping doctors to help more patients is truly refreshing in medicine today, because that's not something that typically is the case. People say, oh, this is my proprietary whatever, and I'm going to hold on to it. But you're actually trying to, whereas people will try to burn bridges, you're actually trying to create bridges and reach across the aisle and empower more doctors to help more patients. That is so refreshing. That is so different. And that's something that people, I don't think, know about you and don't know about the Williams Cancer Institute. And that's something that I found, it didn't surprise me, but, it's good to see. And I think medicine would prosper more if they had more of that.
Yeah. I mean, this is like, we're trying to like open source this, get this people, I understand that there's lots of people that can't come to us. If we can at least give them the information, they can try to push and do whatever they can, whatever way they can help themselves. If we're helping people, that's great. Again, it's like, I know what it was like seeing my grandmother die and being in that situation where, I was a young child, and you have no power to do anything, and being on that end. And so I know what it's like to be in where these patients are. And I don't want people to experience that. I want people to be, want people to be happy and healthy. And that's why we become doctors, right? It's to just get this out to more and more people so that people don't have to suffer. I mean, we want, so yeah, that's why I openly share all the stuff. I don't like try to like say, oh, this is just mine and nobody else can have it. No, I'm like, here, take it. Like, you want it? Here it is. But because, just reach out to more people, help more people.
And truly refreshing. So as we've talked about, you're an integrative radiologist. It's going to be interventional radiologist. But you're an integrative doctor. You're a radiologist, but really what you are is you're an innovator. Mm-hmm. And you just happen to, be a doctor for fun, which is truly refreshing. But, that innovation side, and that's really what brought forth all of what we've just talked about here. So if you want to learn more about intratumoral immunotherapy, go over to williamscancerinstitute.com. You're going to see it. Go to all the social media, go to YouTube. You're going to see it. You're going to hear patients tell you what it is. That quality of life measure, you begin living with treatment, not the other way around. It's truly revolutionary. But where is the innovation going next? Where do you see Williams Cancer Institute? Where are we going? And what's the future hold, do you think?
Yeah. And, again, certainly we're hoping to try to spread these programs around, whether it's Williams Cancer or other groups or whoever it is, but to get more, intratumoral immunotherapy work done. And, I think for me, the end goal for cancer treatment is, again, you diagnose a patient with cancer, or potential cancer, right? They have the potential cancer. You diagnose, treat, do it all at once, get the immune system going, and leave that person intact. Leave that person where, they're cured of their cancer and they don't have to have bad problems, right? You leave them as good or better than they were before they had cancer. And that's my goal. And that's where I think we can do this. I mean, it's possible. I think we have all the capabilities now. It's just trying to get this expanded out, get other doctors on board. Obviously certain drugs we need to get, FDA approval for, and, working on those type of things. But, as we get all of that and allow the doctors to be able to do this and try to change the way that, healthcare, and particularly cancer care, but healthcare in general is done, in trying to, make people healthy and not have to keep treating them and, just get them better and be happy and not have, I don't want people to worry about cancer. I don't want people to worry about their health. I want people to just live life and enjoy it. I mean, I'm thinking this will make the world a much better place. I mean, if we could all live life and we don't have to worry about, health, because health is a looming issue. I mean, all the times, you got to worry, oh my gosh, I have cancer, I have this, I have that, I need to take all these medicines, all this other stuff. I mean, I just want people to be happy, healthy, and live life.
Yeah, which great life lesson there. So, Dr. Williams, thank you always. It's a pleasure and honor to work with you, and it's great to rekindle the friendship, and it's super exciting to be a part of the innovation. And if you're out there listening, if you're a patient, you have a family member, a loved one, a friend that has cancer, again, the future of cancer care, it's not something you have to hope for. It's not something that you have to, wish for. It's available today, and it's at the Williams Cancer Institute. So if you go to the williamscancerinstitute.com, again, you're going to see everything you need to see there, but check us out on social media. Check out all the YouTube, great information there, great testimonials there. And you're going to see Dr. Williams all over the media because of the innovation that he's bringing. Of course, you can see this podcast at Prescribe. It's pre-scribe.com. And thank you for joining us on this podcast. And we will talk to you on the next podcast, where Dr. Williams is going to be coming and giving us regular updates on the amazing innovations that are happening today at the Williams Cancer Institute.